Nonverbal autism. As non speaking autism is not a specific diagnosis, definitions vary. Some people consider non speaking autism to mean that a person does not spontaneously speak in sentences or words that others can understand. Others consider it as having the ability to speak meaningfully at times, but not being able to speak at all at other times. When an autistic person doesn't speak, it's known as nonverbal autism. You may also see it described as nonverbal autism. However, the term nonverbal isn't completely accurate since it means without words. Even if an autistic person is non speaking, they may still use words in other ways, such as in writing. Nonverbal autism is not a distinct diagnosis, but a description of a certain set of symptoms of autism spectrum disorder. Having non speaking autism does not mean that a person cannot communicate or understand language. With the right support, a non speaking autistic person can become a strong communicator with or without verbal language. Having non speaking autism does not mean that a person does not communicate, cannot communicate, or does not understand language. Some non speaking autistic individuals write and verbally communicate in other ways, such as via typing or special communication devices. The absence of speech does not mean a lack of understanding. People should not presume that a non speaking autistic person does not understand speech because they cannot speak themselves or that they are incompetent. Autism is a spectrum diagnosis, which means that a person may have a range of symptoms that affect daily life in ways ranging from mild to severe. A person may have significant difficulties in one area, such as verbal communication. Their other abilities remain intact. Doctors have traditionally thought that it is rare for children over the age of 5 years to learn how to speak, but the reality may not be so clear cut. Some language development can occur between the age of 5 and 7 years, as well as sometimes up to the age of 13 years. Symptoms. Non-speaking autism affect a person's verbal skills. Some symptoms include not spontaneously initiating or responding to conversation, using only a few words or not speaking in complete sentences, using sounds as opposed to words to communicate, although in some cases parents and caregivers may understand the meaning of these sounds, not relying on spoken language as a primary form of communication. Causes. Autism is a complex condition. The diagnosis does not provide much information in itself, as autism causes a spectrum of symptoms. The development of autism who varies from appearing quickly over a few days or weeks to developing slowly over time. Some potential factors in the development of autism include genetics. Researchers have identified some genetic factors that appear to increase the likelihood of autism. A person is also more likely to be autistic if a close family member is autistic. Genetic and chromosomal disorders. People with certain genetic or developmental disorders such as tuberous sclerosis and Fragile X syndrome are more likely to be autistic. Development during pregnancy and infancy. Exposure to certain drugs while in the womb may increase the chance of autism. There is still no evidence to suggest that vaccines cause autism, even in people with an increased likelihood of having the condition. Research indicates that no specific factor is likely responsible for language development in autistic people. However, it is likely that early intervention supports that target an autistic child's play, attention, and imitation abilities may help increase their communication abilities. Diagnosis. Non-speaking autism is not a distinct diagnosis from ASD. Instead, it is a description of a person's symptoms. Non-speaking autism includes a continuum of behaviors from never speaking at all to only speaking in some situation. No single test can diagnose autism. Instead, a healthcare professional diagnoses autism based on a person's symptoms. The diagnostic criteria for autism specify that a person must have ongoing difficulties with social interaction in multiple contexts. Some examples include difficulties with the back and forth of communication, sharing interest or emotion, understanding or responding to social interactions, non-verbal communication, such as the inability to understand gestures or subtle body language or make eye contact, developing understanding or maintaining relationships with others. A person must also have a restricted range of interest and behaviors which may be highly repetitive. Some examples include stereotypical behavior or movement, such as repeating things that other people say, lining up toys, flapping the arms, or using objects in atypical ways, difficulty with change, and a high need for a routine. Hyper focus on particular interests, over or under reactivity to sensory input, such as being very sensitive to light or sound. For a person to qualify for a diagnosis, the symptoms must be present in early childhood, cause impairment in one or more areas of daily life or functioning, not be due to another diagnosis, such as a head injury. Early signs. Certain characteristics can indicate that an infant or young child is autistic. Although these characteristics vary among individuals, a child may be autistic if they have delayed language skills or language skills that appear and then disappear, do not use gestures to communicate by 12 months, do not understand pointing by 18 months, are not interested in other children, do not engage in pretend play by 2.5 years, do not have typical happy, sad, or angry facial expressions by 9 months, do not respond to their name by 9 months, are unable to maintain eye contact or actively avoid it. Support for ASD focuses on caring for people with the diagnosis and helping them learn new skills. Some options include therapy. A wide range of behavioral therapies can help autistic people learn new skills. Speech therapy, occupational therapy, and similar interventions may help them function more independently. Behavioral therapy can focus on the development of social skills. Psychotherapy can help autistic people understand their diagnosis and deal with symptoms of anxiety, depression, and other common issues. Family therapy may help a family better support an autistic person while offering parents or caregivers new skills for managing the child's condition. Accommodations. Autistic people may need certain accommodations at work or school. Medication can help with symptoms that tend to co-occur with autism, such as anxiety, attention issues, and depression. There is no approved medication that can treat all of the symptoms of autism.